To preconception and pregnancy planning. So many of the questions people ask is whether or not IBD can affect their ability to become pregnant. And so when we talk about the word fertility, we are talking about the ability to become pregnant. We know that women with IBD in general have the same fertility as women without IBD. There are two situations, however, that can lower fertility in IBD. The first being if you have active IBD, and the second situation is if you have the ileal pouch anal anastomosis or J-pouch surgery. And I'll now go into a little bit more detail about those two situations. So when someone has active IBD in the preconception, so before pregnancy time period, it can make it harder to become pregnant. It's partly because of the inflammatory burden and also potentially because the mother or the potential mother is not eating enough, not getting enough nutrition. Active IBD can also increase the risk of miscarriage, and oftentimes because one may not realize that one's pregnant early on, we do believe sometimes that active IBD is you have become pregnant, but you may have an early pregnancy loss. And therefore, we do recommend that if you are considering pregnancy, that you try to wait until your IBD is in remission and you are on stable medications that can be continued during pregnancy before you try to become pregnant. And the other situation that I mentioned was if you had that certain type of surgery. So in some cases, a woman with ulcerative colitis may require a colectomy, so that's removal of the colon. And in that situation, they may opt to have an internal J-pouch created from the small bowel. This may have potential risk of damage to the fallopian tubes, and potentially after the surgery may have scarring or adhesions that can block the fallopian tubes. And that is one of the reasons that this type of surgery may reduce the chances of becoming pregnant. If you have had one of these surgeries and you are finding it hard to become pregnant, you should speak to your gynecologist and fertility specialist, as one of the options is to have in vitro fertilization. If you think at some point or you've been told that you may require a colectomy, one of the options is to speak with your gastroenterologist and your surgeon before you have the surgery. And then in that case, they may opt to give you the colectomy and remove the sick colon and give you a temporary ileostomy, as shown in this cartoon. And then they would bring you back after you have completed your family and had your pregnancies to create the internal J-pouch. So it's very important to speak with your gastroenterologist and your surgeons.